what is this infamous barrel I keep talking about, so stay tuned. Hey, Dr. Shakib here from Irvine Spinal Wellness Center, your Irvine Posture and Chiropractic Clinic. One of the things that people talk about is breathing, abdominal breathing. And I don't talk about abdominal breathing, I talk about the barrel. So what the heck is that all about? I keep talking about it in so many of my videos. So abdominal breathing is like breathing and you feel like you want to push your tummy out. And that's part of the proper breathing. That is not correct. So I have done a drawing, forget about all these other things, these are all postural neurology stuff, but let's concentrate here. If this is abdominal diaphragm, and this is a pelvic diaphragm, so imagine I have a barrel, this is the top, that's the bottom. When it comes to the pelvic diaphragm, it's just imagine a surface cutting through you. So it goes from the front to the back. Imagine that. And you're breathing in, your lungs will push the abdominal diaphragm downward, and that pressure goes and hits the pelvic diaphragm straight down, just like these arrows are showing. So this is all inside of this whole body. Imagine that. So you've got a cylinder or a barrel inside of you. Here's this pelvic diaphragm, here's the abdominal diaphragm. Not sticking out, but in. So now when it hits the pelvic diaphragm goes down a little bit because of the pressure, and it can only go so far. Now it's time to come up. As it comes up and it goes towards the abdominal diaphragm, now there is that movement of when you're breathing in and out. So inside of you, as you breathe in and you feel you hit this pelvic diaphragm, the bottom portion starts expanding. And when it starts expanding and the barrel gets bigger, part of it pushes the tummy out. So now if you push your tummy out, of course, at some point, that pushing out applies pressure to the pelvic diaphragm, but that's not the right progression for breathing. You want to practice hitting this and then starting to expand and make the barrel bigger. As you breathe in, what ends up happening is you're playing between these two areas and you start putting pressure, making this barrel, the front and the back and the sides get filled in. So if you make yourself like a hand like this and you put it right above your bones here, put your fingers right there and the thumb in the back, and you place it like this, and you want to make sure you kind of laugh with your mouth closed, and you can feel, you don't go and let go, but you breathe in and you put your hand right above your pubic bone area and you feel the firmness. Keep that firmness. That firmness is a pelvic diaphragm. And then you place your hands here, and now you let the expansion of your barrel. As you expand within you, you feel the pressure from the inside against your fingers here and your thumb. And now you're creating that barrel. That barrel is not going to protect you against, but it safeguards you against injury. It also assists all the different parts of your body to be in a better place, so the muscles that are designed to do their major and primary task have a better chance of doing them correctly. Creating a barrel and breathing effectively is how this is done. Everything else is a modification of. This is how babies breathe. This is why their tummies are so big. They're not fat. They just breathe effectively and their barrel is great. And no, I'm not telling you go drink a lot of beer so you can have a beer belly because it looks like it. That's not what that's all about. Anyway, hope that this helped. Make sure you subscribe to my YouTube channel. Make sure you visit my website to better understand how this even plays a role in movement, in proper movement, in rehabbing injured areas, and in preventing you from injuries. So, thanks for watching. Take care.